James. Hi, it's nice to meet you. My name is Sarah. I'll be your medical assistant today. So it looks like I'm getting you set up for surgery intake, is that right?
That's right.
Perfect, okay. So let's go ahead and get started. I have a couple things. We're gonna go over some paperwork that I'll have you sign. We're gonna go over your mobility status, which just is a convoluted term for are you able to move around and do stuff on your own. I have a couple of supplies that I'm gonna get you set up with, and then your nurse will come in and she'll do your pre-op intake, okay?
All right, sounds good.
Perfect. So how are you feeling today?
Not bad.
Excited? Ready to get it over with? Yeah. Okay. Okay, well, like I said, my name is Sarah. I'll write that up for you. If you need to call me, you can use your call light to page me. My pager number is 68995. Okay, and you look pretty independent, I would guess, at a baseline. Are you able to still complete all of your tasks at home independently? Like you get dressed by yourself, your injury isn't causing you any issues with your mobility? Okay, so we'll go ahead and say that you're independent. If at any point you feel like you need help getting up to use the restroom or anything like that, please hit your call it and someone will come in to help you, okay? Okay, so I will be getting your vital signs. We'll do that a little bit later. I also do need to get a COVID test done on you. It's just part of the pre-op. I know, it's not everyone's favorite thing. I totally get it. So let's go over your chart. Looks like Dr. Perez has a couple consent forms here for you to sign, so I'll go over these with you. And just a formality, can you spell your last name for me?
Sure. M-O-N-R-O-E.
Perfect. And what about your date of birth?
Date of birth is 11/17/1991.
Perfect. Okay, and just before your surgery, the nurse and the doctor will go over the consent form with you again. They'll make sure that the site is marked correctly. Obviously, we want to make sure we're not performing surgery on an incorrect place, so this will be gone over with you again, but just as an initial part of the intake, it looks like you're having surgery on your left arm. Okay, and this is, looks like 1 day inpatient, so you'll be staying overnight and then have your surgery in the morning.
Okay.
And it looks like you'll be heading out a couple hours after that, pending everything goes well.
Gotcha.
Okay, so I'm gonna have you initial here for me. This is just stating that you agree. And then one more time. That one is just a HIPAA policy.
Okay.
And do you have any belongings that we need to inventory for you?
My cell phone.
Cell phone?
And my wallet, that's all. Well, my keys.
Keys.
Yeah.
Perfect. And glasses?
And my glasses. Yeah.
Do you have a cell phone charger?
No, I don't.
Okay, no charger. Should you need one, we do have some at the front desk, so just let me know. All of that we will have inventoried for you. Once we take it, we'll take it right before your surgery. We'll have you sign a consent form, and then when you get out of surgery, we'll have you sign it back out. Perfect. Okay, so I'm just going to have you initial here, and this is just stating that we've inventoried your belongings. Thank you. Okay. Doesn't look like... Okay, last one, and this is just consent for the COVID testing.
Okay.
Perfect. No COVID symptoms or anything in the last 14 days? Okay. And you haven't traveled out of the country or anything? Okay. All right, James, well, let's go ahead and get started. I have a bunch of things here for you. So we have a little nausea bag in case you start to get nauseous. I also have a pair of socks for you, and these are a surgical requirement, so the nurse will have you put these on right before you go to your surgery.
Okay.
also have a little deodorizing spray, face mask, a little bag you can put on your bedside table for trash. Nasal cannula that I will actually be putting on you now. Some oral care supplies so you can brush your teeth. And then we also have the CHG wipes, which I'll go over with you.
Okay.
So I will set this stuff here. You're welcome to come grab it whenever you need. The restroom is right over there. Okay, so let's go ahead and get started with your vital signs. So I am going to go ahead and come around. All right, James, so let's go ahead and do your COVID test. And I am so sorry. So with a little swab, you're welcome to close your eyes. I know it's uncomfortable. I'm going to start with this side.
Okay.
Very good. Moving to the other side. Okay, I'm sorry, we're all done.
Okay.
So I will get this processed and we'll send your results off to the lab.
Okay.
And let's go ahead and take your vitals. So I have a thermometer here. I'm going to do under the tongue. Perfect. Do you mind holding on to that for me? There you go. Okay, let me have a look. It should be done. 97.8, perfect. No fever. I'm gonna go ahead and take your blood pressure. Do you have a preference what side we take it on?
I guess the same.
Okay. Okay. A little tight. Okay, relax your arm for me and I will get that connected. And we'll check your oxygen on the other side. Perfect. And I am going to start you on a nasal cannula. This is just part of your doctor's requirements. We want to make sure that your oxygen is being supplemented before we get you in surgery. So you will wear this all night. Can be a little itchy on the nose. Let me know if it's uncomfortable. We can ask if it's okay to do without it, okay?
Sure.
A little more. Very low flow. It's just supplemental, like I said.
Okay.
Does that feel okay?
That's fine.
Okay. I will get that connected for you. Okay, it looks like your oxygen is perfect, 99%. No complaints there. And blood pressure is also all done. 132/78, which is good. So I'll leave these in here. Obviously, we will be checking them periodically. And James, the last thing I just want to show you is these chlorhexidine wipes. We will need to do this twice, unfortunately. So tonight when you take a shower, you're going to shower regularly, regular soap. There's supplies in the restroom. I do need you to use these. Have you ever used these before?
No, I haven't.
Okay. So it's a pack of 3. Each one comes with 2 wipes. And you need to use all 6 of them. You're going to avoid using this on your face or your private area, but everywhere else you want to use it. If you need help with your back, let me know. I can come in and help you with that.
Okay.
It's 1 wipe per area, so there are directions on here. Basically, you're going to use 1 for this arm, 1 for this arm, 1 for your chest, so that's 3. 1 for your stomach and your back, and then 1 for each leg.
Gotcha.
Okay. Like I said, if you need help, let me know. We do have a special lotion that you can use with this. No other lotions are approved, unfortunately. They do deactivate the CHG. It's just an antimicrobial. We're trying to decrease any bacteria before you go into your surgery. And like I said, you will need to use this again in the morning.
Right.
So the nurse will come in and help you do it again before pre-op, okay?
Sure.
So I'll leave these here for you. Like I said, after you shower, get that done. When you do, let your night shift nurse know just so we can check it out for you.
Okay.
Okay?
Yep.
Okay, well, that's all I have for you. Do you have any questions for me? Okay. Well, like I said, the nurse will be coming in. Your night shift nurse name is also Sarah, coincidentally. She's very nice. She'll help you get settled and do a little more in-depth with your pre-op needs. And then in the morning, good luck with your surgery.
Thank you so much.
Okay, no problem. Have a good night.
You too.
Call if you need anything, okay?
Okay, thank you.
All right, James, welcome to PACU.
Hey, thank you.
My name is Sarah. I'm going to be your RN today.
All right.
I see your medical assistant, also named Sarah, already came and introduced herself. It looks like that was last night, so she's gone home, but I'll go ahead and write my name up here for you. So my name is also Sarah, and PACU's pretty small. I don't think you're going to need to page me, but I'll go ahead and give you my extension. It's going to be 69858. In case you do need to call me, you can use your call light, or you can page me on the room phone. So I'm just going to get a set of gloves on and tell me a little bit about what's going on. You're having surgery this morning.
Yeah, I have a surgery on my hand here.
Yeah.
Yeah.
Are you in any pain currently?
Yes, I am.
Okay. What's your pain level right now?
Probably about a 5.
A 5. Okay. So kind of 5 standing pain.
Yes.
So can you tell me a little bit about what happened? I heard something about an attic window.
Yeah, I was upstairs in my attic trying to open up the window to get some fresh air in there. And apparently the window is painted shut. So when I pulled it up, the window just shattered. So there's for sure glass in
You
my
probably
floor.
have some glass shards in there.
Yes.
Sounds like it would be pretty uncomfortable.
No fun at all.
Okay. Well, basically what I'm going to be doing as your PACU nurse is going over a couple things with you. I do need to start an IV. Your surgeon has elected to do just general awake anesthesia. So you will be awake for the procedure, but you will be kind of semi-sedated.
Okay.
Is that something you're comfortable with?
That's fine.
Okay. Aside from that, I do need to just do like a brief inspection, make sure you're looking okay, make sure you're breathing okay. We already have you on the oxygen and you've been on oxygen all night, correct? Yes. Okay, good. That's just a requirement by your surgeon. Everyone is super specific here, so that's good. Looks like we've got our setup ready here. So why don't we just go ahead and get started? Right. I'm gonna start by placing a couple bands on you here. No allergies, right? I didn't see any allergies in your chart, so we don't actually need that one. But I am gonna place a fall risk band on you. This is just because you're gonna be on the local anesthetic. We wanna make sure that we're giving you a little bit of extra help there because people tend to get kind of dizzy. And since we're actually gonna be operating on this arm, I'm gonna go ahead and put this on this side. Sure. So we have that on, and that will stay on you. And I'm gonna go ahead and get started with my inspection. I just want to listen to your lungs and your heart. Okay, so I'm gonna have you breathe normally at first, okay?
Sure.
Just regular breath. Good, regular breath. Okay, and then I'm just gonna undo a side of your gown if that's okay. Sure. I just wanna have a little better listen here. So take a slow, deep breath for me. Good. Slow, deep breath. Go ahead and breathe out. Good, okay, so heart and lungs both sound totally healthy. Okay, so since I have your gown open, I'm gonna go ahead and place your tele leads on, and just got 5 little stickers here, and these are going to connect to the heart monitor. So when we get you to the OR, we're gonna get you hooked up to a couple different monitors, and it'll just help us keep track of your heart, okay?
Okay.
So I'm just gonna kind of reach in here. Perfect, okay. Okay, so we're all good there. I can get you buttoned back up for now. And do you want to do just a quick check of your pupils? All right, so I'm gonna have you just look straight at me. And I saw that Sarah inventoried your glasses.
Yes.
Perfect. So I'll let you keep those right up until we take you to the OR. I'm gonna have you follow the light, so keep your head straight, directed at me, follow the light with just your eyes. Good, very good. A little faster. A little slower, good job. Any double vision here?
No.
Not seeing any floaters or anything. No. The light looks pretty normal throughout.
Yep.
Perfect, okay. So the next thing I'm gonna do is have you look at the light. And now look over at my finger. Good, and look at the light. And my finger here. Perfect. And no double vision with that either?
No.
Okay. So I'm just gonna have you look down for just a second. And then look up. Good. Okay, can I have you just open your mouth and say "ah" for me? Perfect. Throat looks clear. Never have any issues with swallowing or anything like that? Okay. Is it okay if I just have a couple feels of your throat there? Just want to get a couple palpations here. I didn't see anything in your history about trouble swallowing or any kind of edema in this area where I would think you would need to be intubated. If for some reason you do, that's something that we would obviously assess as it comes along, but for the most part, I think you're going to be pretty okay to do the awake anesthesia. We will have you continued on the oxygen. Open and close for me. One more time. And then can I just have you swallow? Perfect. Okay, so no issues with that as far as I'm concerned. I do want to do just one more thing. Since you're having surgery on your arm, I just want to do a very brief sensation testing, and that's basically so that we can assess it afterwards to make sure that there's no nerve damage during surgery. Okay. The risks are very, very minor, just something we want to make sure of, okay? So let's start with unaffected arm. Yes. Just close your eyes for me. Tell me if you're able to feel this.
Yes. 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 Yes.
Okay, and how about this?
Yes. Yes. Yes.
And does this feel different than this?
Yes.
What's different about it?
A swipe versus a poke.
Okay, and is this, would you say soft versus this sharp?
Yes.
Okay. Go ahead and relax your arm. I'm going to do the same thing on your affected arm. I'm going to just try to avoid that area because I know it's pretty painful. So
thank you.
Close your eyes for me. Can you feel this?
Yes. 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 Yes.
And can you feel that this is sharp?
Yes.
Okay. So the last thing I'm going to do for sensation is I want you to tell me, actually a couple more things. I want you to tell me kind of bilateral sensation test here. This versus this, does that feel the same?
Yes, it does.
So same here.
Yes.
And if we do same,
yes.
same.
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 And no sensation loss on either side as we go down?
No.
Perfect. And last thing, promise this time, I want you to just tell me if you feel cold here.
Yes. 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 Yes.
Okay, and no loss of sensation as we go down.
No.
Cold all the way down.
Cold all the way down.
Cold, cold.
Yes. Yes.
Good. Okay, very good, James. We will be retesting all of those later on after your surgery. The PACU nurse will retest that for you, okay? The post-op PACU nurse. Okay. So a couple things. Sarah did a COVID test and it was negative. Good news.
Good.
So don't have to worry about that. You won't have to have one redone. I do have a couple medications that I want you to take. I will give you these right after the surgeon comes in to talk to you. So she'll come in, she'll do just a brief once over what's going to go on during the surgery. I'll have you take these. They'll help you kind of relax a little bit.
Okay.
So 4 different things here. This one is an anticoagulant, just blood thinner basically, so you don't get any blood clots while you're in surgery. We have lorazepam, which is an anti-anxiety medication. It's just going to help you relax a little bit.
Okay.
I also have oxycodone, which is a pain med. You did say that your pain was already at a 5, and then after surgery, obviously, you're going to be in a little bit of pain, so we want to go ahead and go with that. And then the last one is just an antibiotic to prevent any infection during surgery. Okay. All those good with you?
That's fine.
Perfect. So we'll have you take those a little bit later.
Okay.
And what I'm going to do now actually is have a seat. I am going to come a little bit closer to you. I need to get an IV in you, okay? So we're going to do a peripheral IV. Shouldn't really cause you any pain, but let me know if it's uncomfortable. But this is pretty important for surgery. We need a way to access your veins in case of an emergency.
Okay.
Also is going to be the way that we give you that anesthetic, okay?
All right.
Perfect. So let me just scooch over a bit and we'll get started. Okay, so let's go ahead and get started with your IV. I'm just going to be touching your arm here. Is this a comfortable position for you?
Yeah, this is fine.
Okay. I'm just going to move this out of the way a little bit there. Have a look at your veins. And go ahead and take my light. So are you nervous for surgery at all? Are you feeling okay?
I'm okay.
It's a very minor surgery, and your surgeon today is so good. So.
Okay.
Early surgeries, I always say, are the best. You want to catch them while they're nice and rested. So veins look pretty good. Do you ever have any issue having your blood drawn at all?
No, I don't.
Feeling around. About in there. Oh, maybe here. I think we got a good one here. Okay, so I think we're gonna go here.
Okay.
Warm that up a little bit. Okay, so I just have a ChloraPrep swab. And it's gonna feel a little wet, okay? It's just basically alcohol. Make sure we get that nice and clean. Perfect. Have you lift your arm up for me? I'm not gonna do it too tight. I don't want it to be uncomfortable. Let me know if this is too much. Is that okay?
It's okay.
Okay. Perfect. So if you can, is this an okay place for your arm here?
That's fine.
Okay. So I'm gonna do a 20 gauge, a little bit bigger than a standard IV. Reason for that is we need to be able to get emergency medicine in.
Okay.
So we want to have it big enough to where we have the space if we need it. Likely won't, but better to have it than not. Perfect. Okay. All right, James, so we're going in with a little poke here. It is going to be a little tiny bit uncomfortable, okay?
Okay.
So maybe you want to close your eyes.
Okay.
Ready?
Yes.
Going in. How was that? Not bad?
That was fine.
Okay. We're in there. I'm just going to get you connected here. Bear with me as I hold on to that. Still doing okay?
Yes.
Just gonna do a quick flush, make sure our blood return's looking good. Yeah, we're good. Gonna pull back. And, all right, very good. No pain there?
No.
Perfect. Okay, so let me get you covered up. I do a little bit of a bigger dressing here. Stretch that arm out for me. There we go. Perfect. Okay. All right, very good. So I'm gonna go ahead and cap that off for you. Just a little infection prevention. And then just so this isn't hanging down so much and getting on your nerves, I'm just gonna tape that off. Okay, so this is Coban, and basically it's just gonna make it so I'm not putting the tape on your actual skin. So lift your arm for me. How's that? Too tight?
No, that's fine.
Perfect. Okay. All right. Well, we are good to go. I am just going to take a couple measurements here. The last thing I need to do is block off the site.
Okay.
So the surgeon just wants me to kind of prep the area. I'm going to do a couple measurements. I have my surgical marker here. I'm going to block the site off for her. Okay. And after that, she should be coming in. Okay? So she'll come in, talk to you for just a second, and then it's pretty quick. I'm going to prep the OR. After she scrubs in, we'll get you in, and shouldn't be that long. Okay?
All right, sounds good.
So we'll turn your arm over here, and no, it's a little painful. I'm going to try to be careful. So I do just want to see. I want us to give us a little bit of leeway there. So she tends to be kind of conservative with her incisions, so they're usually pretty small. Does that pain radiate out here, or is it mostly centered right where you have that?
It's kind of in the center.
Okay, so we're okay here.
Yes.
Okay. So I'm going to block off a little bit of a smaller area than what I normally would, only because I don't think we're really going to need to come out that far. So I think we're going to be looking at about here. And then obviously we're going to be working our way in there. Okay. And then I'm going to kind of go center it off there because it looks like most of it's kind of okay. All right. So she'll be coming in to look at that, and Be getting you in shortly. Okay, let me go ahead and clean this up. I will page her and let her know that you're ready.
Okay.
And I am going to go prep the OR.
Okay, thank you.
I'll see you soon. You have your call light. Call if you need anything.
Yes.
Okay? All right, James, welcome to the OR. Let me just get my surgical gloves on. It looks like Sarah's gotten everything ready, and you're okay with everything we talked about earlier, correct? Just to confirm, still a go.
Yes.
Okay. Should be very careful for me. I want to make sure we're keeping this sterile as we can. Okay. Now, I'm going to start by accessing that IV. Let's go ahead and get you injected with some pain medication. Okay. So this is going to be that local anesthetic that we talked about.
Okay.
So you're going to be awake. You should be feeling okay. Nurse gave you some hydrocodone, correct?
Yes.
All right, ready?
Yes.
So it's not going to put you to sleep like I said, but you are going to feel pretty sedated. Okay, you should be already feeling it kick in. Are you numb?
Yes.
Can't feel anything here?
No.
Perfect, okay. Okay, so we're gonna go ahead and get started. Looks like we've got it pretty boxed off here. I'm happy with the grid. This is gonna be a very small incision, and we're looking for shards of glass, correct?
Yes, we have.
Okay, so I want you to lift your arm up for me. And go ahead and relax it down. Very good. I'm gonna clean the area here. This is an iodine swab, so this is gonna be pretty cold, okay? Okay. Just give that a second to make sure we're fully sterile. No feeling here, right? No. Can't feel any of this?
No.
Can you close your eyes for me? Can you tell me what finger I'm touching?
I can't tell.
Can't tell?
My middle finger.
Okay. Middle finger here?
Yeah.
Okay, good. All right, James. Let's go ahead and get started. I'm gonna make a little incision in our sterile dressing here. Alright, I've got a good look at your skin. I see where that inflammation is at. Okay, so I'm going to go in with my scalpel. Can't feel any of this, correct?
No.
Nothing here. Okay. All right, little incision. Okay. very still for me. Let's see what we can find. We might actually need to go in a little further because so far I'm not seeing anything. And your x-ray did show some glass in your arm, so let's deepen that a little bit here, okay? Oh, I think I got a glimpse of something here. Yep. You see that?
Yeah.
Okay, so we have at least one piece of glass. Doing okay?
Yeah.
Did you see how much went in your arm?
No, not exactly.
Oh. One more. Just be careful with that. I don't want to hurt anybody else. A little piece of tissue coming out. Don't be alarmed. Oh, that's a big one there. Okay. Yeah. Okay. I think I see another one. Wow, you really... This one's in a little bit deep. I'm going to apply a little bit of pressure here. This one's hiding from me a little bit. I think I got it. There we go. Another piece there. Okay. Oh, we got another one coming out. There we go. Okay. Little bit of tissue. I'm not seeing. I think we might have gotten it all. Oh, you know what? Actually, I think I see the last piece here. There we go. Wow, okay. I'm just gonna have a last look here, but I'm pretty sure we got it all out. Okay. So incision ended up having to be a little bigger than what I anticipated originally. Sometimes that's unavoidable, unfortunately. So I am going to take some gauze and just clean this out. So I'm going in with a little bit of that sedative, mostly some saline. And I'm going to wash this out. Okay. Pack the wound. Want to make sure we're washing all that debris out. Doing okay? Okay. All right. Well, I am going to go ahead and sew you up. I'll do a couple sutures here. Shouldn't feel any pain with this, okay? About halfway there, James. coming up on the last one. Okay, I'm gonna get you tied off here. Okay, go ahead and have a look, nice and clean. Even incision there. I know it's a little difficult to look at. I apologize, but it looks good. Not seeing any reason why it should be prone to infection, and it looks like you got that antibiotic. So incisions are looking good. I am going to close up with just some more of that iodine. Make sure we're really keeping that clean. I'm going to go ahead and bandage you up, okay? The PACU nurse will undo the bandages in a few hours, get you transferred over to some steri strips, but for now, I want to keep it covered, give it a chance to settle.
Okay.
So I'm going to take this off. Okay, getting you nice and wrapped up here. It's going to be a little tight. The compression is going to help with any swelling. Lift your arm for me if you can. I know it's hard with the numbing. Okay, so that initial compression is going to hold this in, and then I'm going to do a final just to keep it clean. So we're going right over here. Shouldn't feel any pain with that. Coban. Alright, looking good. Nice and clean. PACU nurse will get you taken out, get you back to your room, okay? Alright, thank you so much. It was good seeing you. Alright, James, welcome back. Welcome to recovery. How's it going? Couple hours out. Okay, so Dr. Perez wants me to go ahead and remove the sutures. We're doing an early removal to get the best healing for you. Try to minimize the scarring since it's on such a noticeable area here, okay? So you should be getting some feeling back. Are you in pain? A little bit of discomfort maybe?
Discomfort. For sure.
Okay. So when I cut around this initial layer, it shouldn't be too bad, but that first layer is on pretty tight to help with the swelling. So you might feel a little bit of pressure there just when I release it, just from the tension letting go, okay? All right, so let's go ahead and get started. I'm gonna cut into this, kind of go layer at a time here. The good news is your vital signs stayed stable throughout. No issues with your oxygen dropping or anything like that. Your blood pressure looked good. Heart rate's doing okay. You were a little tacky at one point, but other than that, we're looking good. Okay. I'll do this side. Are you wanting any pain medicine right now?
I don't know, I'm not sure.
Okay, well, if you decide that you're uncomfortable in the next few hours, we could always do Tylenol, like an extra strength Tylenol, or you could have another dose of the same pain med that you took earlier. Just let me know. But we should have you out of here by 8 o'clock, I would guess, okay? We are going to send you home with the prescription, just an antibiotic to help reduce any inflammation and possible risk of infection. May go ahead and send you home with a dose of that Tylenol just so you have it if you need it. Okay, look at that. Wow, Dr. Perez did a beautiful job, very even. Good. Okay, well, I'm gonna have you turn your hand just a little, and I'm gonna go ahead and release these, okay? Should maybe feel a little discomfort, but shouldn't be painful.
Okay, I'm not gonna look.
Okay. Last one. Good. Incision looks nice and tight. I'm going to go ahead and pull these out. You know what I'm actually going to use? I can actually go ahead and pull them out manually here. They don't look like they're... There we go. Yep, they're ready to come out for sure. Okay, we got the last one. Incision looks good. I'm going to go in and clean that for you. Good. All right, we're gonna go ahead and place some steri strips down. And basically these are just fabric strips. They're gonna pull your skin together, keep it tight so that it can heal closed. You can get these wet, they're waterproof, and they will fall off on their own. So they should fall off in about 4 days, okay? So we're gonna do this pretty tight because I do wanna hold that together, but I am gonna cut them, I think. sure that's dry first. Okay, good. Okay, a little bit of pressure. I'm going to pull this pretty tight. Make sure they stay on. And then I'm going to wrap this just in a light gauze and a Tegaderm. It's like a clear wrap, the same thing we have on your IV, which I am going to take out. I want you to leave it wrapped probably for the next 24 hours. Don't recommend getting it wet. After that, you can take the wrap off and then you're welcome to shower as normal. Like I said, after about 4 days, they should fall off, okay? So let me cut you out of the rest of this. All right, we got you all untangled here. And I'm gonna go ahead and fold this in half to give you a little bit of padding. Over the top. And then just to make sure that it's gonna stay, I'm gonna give you a little bit of extra tape. You hold that for me. Beautiful. All right, let's get this IV off of you. Get all this up from underneath you. Okay, I'm gonna flush this one more time. Okay. Let's see. Okay, we're getting there. I'm gonna go ahead and pull it out. You ready?
Mm-hmm.
Good. Just hold this down for a second. And okay, a little bit of bleeding, totally normal. I'm just gonna give you a little Band-Aid here. I can take this off after about an hour. Okay, well, everything looks good from my standpoint. I'm gonna get a last set of vitals on you and we'll have you hang out for a couple hours. I'm gonna get your discharge paperwork ready. I will get your prescription sent over. Okay. CVS is still okay?
Yes.
Okay, perfect. You rest. I do want you to call me if you're in any pain. And then the last thing that I wanna do just real quick to make sure is test that sensation again. Should be fully back, but sometimes the numbing medication and the anesthetic can have a little bit of a longer side effect. So I just want to make sure we're doing okay here. So close your eyes for me. You feel that?
Yes.
Here.
Yes.
Here.
Yes.
Feel this?
Yes.
Is that painful?
Not painful, but it's not
sensitive.
Yeah.
Okay. And you feel that that's pretty sharp?
Yes.
In comparison to this?
Yes.
Okay, so if this is the top and this is the bottom,
yes.
Which one is soft and which one is sharp?
The top is soft, the bottom is sharp.
Perfect. How about now?
The top is sharp, the bottom is soft.
Can you feel this?
Yes.
Good. Feels dull here, but you can feel it.
Yes.
Sharp, sharp, sharp.
Yes. 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 Yes.
Good. And then still cold.
Yes.
Same cold as earlier.
Yes.
Cold, cold here.
Yes. Yes.
No cold loss at all as we come down here, right?
No.
No cold loss up.
No.
Perfect. And you feel that?
Oh, yeah. Yes.
Okay. Well, like I said, good to go. Let me get that stuff ready for you. Call when you need me, okay?
All right.
All right, James. Thank you so much.